to 49% of medical claims face denials due to many different reasons. Denial codes are an unfortunate truth when it comes to working in medical billing and coding. While it is impossible to avoid them altogether, you can cut down on your denial rates by taking certain steps. For those who are just getting started in their medical billing journey, let's talk about what denial codes even are. A denial code is a standard message that provides information about a claim that an insurance company has denied. These codes are what health insurance companies assign to claims that they cannot process. Then they send the claim back to the provider for reassessment. It is then that the medical billing team must rework the claim based on the notes given to them by the payer and fix any errors made. Denial codes are usually found in a claims electronic remittance advice, or ERA. Being able to prevent the denial before it happens is best practice, as it wastes time and money to have to appeal to them. There are a few common denial codes worth knowing. By familiarizing yourself with them, this will make it easier for you to avoid them altogether. A great example is denial code CO273. Today we will go over what this code means, how to prevent it, and what to do if you need to address it. Receiving denial code CO273 means that you have exceeded coverage for a procedure or service. Payers use this code when they determine that the service or procedure is not covered by a patient's insurance plan, or it exceeds a payer's allowed limits or restrictions. The CO in CO273 stands for contractual obligation. This claim adjustment group code determines who is responsible for unpaid amounts of the claim balance. CO refers to the agreed upon amount between payers and providers. So long as you are in network with the payer, the patient is not responsible for this amount. Receiving this denial code means that the healthcare provider now needs to either adjust the claim or possibly explore alternative options for payment. But remember that prevention is the best medicine. Let's take a look at some common reasons billers run into CO273. Lack of prior authorization can often be the culprit of these pesky claim denials. Along a similar vein is performing a non-covered service. Patients who receive services which are not covered by their insurance are likely to cause you a claim denial. Always be sure to double-check coverage through a patient's insurance beforehand. Another common cause is that you, as the patient, have already reached the maximum of benefits available. You may have also sought care under an out-of-network provider, or sometimes errors in coding or documentation are enough to trigger this denial code. For example, if the documentation provided does not support the medical necessity of the service, you might receive this claim denial. You may also receive denial code CO273 if you surpass the payer's time limit. Some insurances have certain time limitations depending on service or procedure. Finally, you can receive this denial if there are issues with the coordination of benefits. Specifically, if there is confusion or miscommunication between primary and secondary insurances. So let's say you do your best to avoid this denial code, but that still isn't enough. Don't panic. There are steps you can take to quickly remedy this situation. First, review the patient's insurance policy. By doing this, you can quickly determine the reason for the denial code. This shows any potential errors or discrepancies the claim may have. Double-check all of your information while reviewing your claim denial. Correct any errors before resubmitting. Gather more supporting documentation if necessary. Proving medical necessity can look like providing physician notes, test results, and treatment plans. If an appeal is necessary, follow the specific appeal process outlined by the insurance company. Include all supporting documentation you have and be sure to keep an eye on the status of that appeal. Finally, follow up with the insurance company to ensure your appeal is being processed in a timely manner. If you'd like to learn more about denial code CO273, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.